new global report on food crises reminds us that COVID-19 pandemic is not only a health crisis, it's a nutrition crisis. Physical distancing and the shutdown of markets and transportation systems are fueling what could be the worst economic crisis since the Great Depression. Lost jobs, dwindling household incomes, rising food costs, and limited food choices. These effects will take a devastating toll on children's nutrition. In low and middle income countries, 2 in 3 young children are not eating well enough or often enough, and what they do eat is of poor diversity, threatening their development, growth, and even their survival. To prevent the COVID crisis from spiraling into a nutrition crisis, governments and public and private sector partners should act now to invest in food, health, and social protection systems in every country, to safeguard access to nutritious and affordable foods, and to scale up the early detection and treatment of malnutrition. It's not too late. Let's work together to stop this crisis in its tracks.
Good morning, good afternoon, good evening, everyone. I'd like to wish you all a very happy new year and hoping that 2021 will be a better year for all of us. Welcome to ARNEC's second webinar series entitled Nurturing Care for Young Children, Seeking Solutions for Addressing Disparities Heightened by the Impact of COVID-19. I'm Evelyn Santiago and I'm the Executive Director of the ARNEC Secretariat. For those of you who are not yet familiar with ARNEC, we are a regional network whose main objective is to promote holistic and inclusive early childhood development in the region. We serve as a knowledge platform for ECD professionals and practitioners in the region, and we strongly support cross-country collaboration and learning around the ECD. We bring to you this second webinar series in partnership with UNICEF, UNESCO, Open Society Foundations, Save the Children, Plan International, and Child Fund Alliance. In this second webinar series, we dig deeper into the impact of COVID-19 on the different elements or components of nurturing care for young children and what policy and program solutions are being undertaken in the countries to ensure that young children are nurtured and protected. As such, the webinar series will cover the impact of COVID-19 on early learning opportunities, health and nutrition, responsive caregiving, safety and security, and how these components are actually interlinked and indivisible, and all are necessary if we are to address the holistic needs and the development of young children. In this series, we would also highlight specific actions or interventions which try to address conditions of disparity, because we know that the impact of COVID-19 is worst for the most vulnerable groups, which actually include children with delays and disabilities, children living in poverty, living in informal settlements, living in rural and remote communities, children of refugees and migrants, and children of ethnic and linguistic minorities. With this focus, we outline 3 objectives for this webinar series. First is to generate good practices in terms of local or country level solutions to promote nurturing care and inclusive ECD. Second is to discuss evidence-based studies which can help countries refine and redesign their interventions. And third, but most importantly, is to trigger conversations in the region and explore how we can collaborate around multi-sectoral advocacy in support of integrated and inclusive ECD during and beyond the pandemic. For today's webinar, which is the second session in this series, we will be focusing on health and nutrition and how this component of nurturing care is affected by COVID-19. This issue of nutrition is very important in the development of young children, especially for the 0 to 3 age group, and most especially in a region where cases of malnutrition are really high. This webinar will be moderated by Jyoti Dingra. Next slide, please. And Jyoti is a development professional with more than 30 years of experience providing strategic guidance and policy support to international NGOs and the United Nations in Asia. She is also one of the ARNEC national representatives for India. Again, Jyoti, thank you for agreeing to moderate this webinar, and over to you.
Thank you, Evelyn, for that presentation and for the introduction to the webinar. I hope you all can hear me well. If not, let me know and I'll see what I can do to change the audio settings. I'm delighted to welcome you all to this session on health and nutrition and its impact on young children, especially during the COVID situation. What we have today is the focus on health and nutrition is absolutely critical for children's development, both in the immediate terms and in the longer term. It has implications that go beyond early childhood. We have with us today a very eminent set of panelists whose experience spans from advocacy, both at the global and national level, to research, to actual programmatic interventions that have taken place. Andrea, can we go to the next slide, please? Thank you. Before I introduce the panelists, let me just give you a couple of reminders about how the webinar is organized. It will be recorded and the resources that I shared will be made available on our next website afterwards. Please do use the Q&A box that is in the Zoom meeting center to ask questions. You can upvote a question by clicking the thumbs up symbol that's there. I would also like you all to remind you that ARNEC conducts a number of webinars, and there will be some more that will be coming up. Please join us as ARNEC's member and be informed about the next webinar. We would also like to request for your feedback on the webinar. So please do help us with the organization of the next one by completing the short survey that will be sent using the link after the session. Next slide, please, Andrea. Thank you. So today's webinar will focus upon 4 questions. One is on the challenges that the delivery of health and nutrition services, including those for maternal, newborn, and child health faced, particularly in the most vulnerable groups during the pandemic. The second question is, how did the governments and other partners redesign, refocus their health and nutrition policies and programs, starting from prenatal care, the interventions that they took to prevent wasting and stunting, and immunizations to address these needs in the context of the pandemic. Next slide, please, Andrea. The third question is, what have been the successes in providing health and nutrition services in the last 6 months? And then the fourth is, what are the challenges that still remain? And what key messages would you like to share? And what is the call to action? Next slide, please. So with that, I bring you our speakers and presenters for today's session. We will start off the presentation by Ms. Deborah Didio. Deborah is a Senior Nutrition and Strategy Advisor at the Scaling Up Nutrition Movement Secretariat in Geneva. Next, please. We have with us the second presentation that would be led by Katerina Elizabeth Karipanon. Katrina is an early career researcher in the School of Health and Society and Early Start at the University of Wollongong in Australia. And she will be, and her presentation, accompanying her on the presentation will be Ms. Hongyan Guan, who is an associate professor in the Department of Integrated Early Childhood Development of Capital Institute of Pediatrics in Beijing, China. Next one, please. We have with us Dr. Sujit Ranjan, who is the Executive Director for the Coalition for Food and Nutrition Security in India. And then finally, we have Dr. Reverend Brian Sri Pahasuti, who is a Senior Advisor at the Executive Office of the President of Republic of Indonesia for Health, Women and child strategic issues. So with these panelists, what we are bringing to you are experiences in research, in advocacy, in interventions. So with that, I would like to now invite Deborah to start her presentation. And please remember to put in your questions in the chat box or your comments, and we will take these on either live or we will find ways to answer for you afterwards. Thank you. Over to you, Deborah.
Thank you, Jyoti, and thank you to the colleagues of the ARNEC Secretariat for inviting the Scaling Up Nutrition Sun movement to this webinar. Let me quickly share my screen and presentation. First of all, again, thank you very much. I will be presenting today the approach of the Scaling Up Nutrition movement, or SUN, to protect nutrition in COVID-19 response and recovery. First of all, why nutrition? Nutrition is foundational, is everybody's business. You've heard from the video that was played before by Henrietta Fore, the Executive Director of UNICEF, how important nutrition is for the child growth, development, and survival. Nutrition is multi-sectoral. There's no one single sector that can address nutrition on its own, and it underpins all other development initiatives. In this small graph that I put on my presentation, you see the link to nutrition to at least 12 of the 17 SDGs. And it's also great value for money. Every dollar that a government invests in nutrition can bring up to $16 in return. What is the vision of the Scaling Up Nutrition movement? SUN's vision is for a world free from malnutrition. It's a global effort. The SUN movement is a global effort to eliminate all forms of malnutrition based on the principle that everyone has a right to food and good nutrition. And it is unique in its way because it brings together people from government, civil society, the United Nations, donors, businesses, and research in a collective effort to improve nutrition. We have just celebrated our 10-year anniversary, and we have also just launched our strategy for SUN 3.0, which will bring us from 2021 to 2025. The movement today brings together 62 countries from every region in the world. You can see on the map, we welcomed the 62nd country in 2020, Timor-Leste, and also 4 Indian states. This means that governments, because SUN is supporting governments and is under the leadership of national governments, the governments have committed to scaling up nutrition, which means they've committed to work in a new, innovative, and more coordinated way, working collectively to address all forms of malnutrition in their respective countries. The SUN way of working, we have a secretariat, which is based in Geneva, and is under the leadership of the SUN movement coordinator, lead group, and an executive committee. But most importantly, at national level, the government is in the leadership through the SUN government focal point, supported by networks of stakeholders. This means that different stakeholders have come together to create networks and try to align action and work more closely together. There are civil society networks in some countries. There are business networks, which brings together private sector actors for nutrition. There are SUN donors networks, which brings together donors, as well as UN agencies through the United Nations networks. Why early childhood development and nutrition are linked and how they are linked? The period of early childhood development is a time of outstanding growth and where optimum nutrition is key. Children under 5 in low and middle income countries are at risk of not reaching their developmental potential due to poverty, nutritional deficiencies, as well as inadequate learning opportunities. Lack of proper nutrition in early childhood development during those years of early childhood development can lead to stunting, which means growth retardation, and that globally affects 1 in 4 children, too many in the Asia-Pacific region. Despite all of the above, there is not enough investment in young children and early childhood development. And as we have heard from Henrietta Fore in the UNICEF video, the COVID-19 crisis is only making the situation worse. What has been the COVID-19 impact on nutrition? First of all, the crisis has created, but also continues to create multiple shocks. It is expected that the crisis will have an unprecedented impact on all forms of malnutrition, stunting, wasting, micronutrient deficiencies, and also overweight and obesity, and that an impending large-scale global food and nutrition emergency is upon us. You may have heard the call for action from the World Food Programme, the recent Nobel Prize winner, which is also a UN agency member of the Sun Movement, calling for action to avoid a food and nutrition crisis. The disruption to food, economic, and health systems are driving an increased burden to all forms of malnutrition. And recent estimates from a modeling of the Standing Together for Nutrition initiative have shared that by 2022, the nutrition crisis could result in an additional 9.3 million wasted and 2.6 million stunted children globally. This means that unfortunately, an additional 160,000 children could die. Failing to act now to protect people's nutrition will only result in an irreversible damage and long-term negative impacts on people and economies. And of course, it will deprive children of the possibility to grow, thrive, and I will say even worse, to actually reverse the progress that we have been able to make in the last 10 years in nutrition and early childhood development globally. The impact of the COVID-19 crisis in the Asia-Pacific region has been great, probably too actually important, significant. At the start of the crisis, there were already an estimated 10.5 million children under 5 in Asia that were suffering from wasting. Over 78 million children who were stunted, 17 million children who were overweight, and unfortunately anemia is also affecting 400 million women in the region. Of course, there's been disruption in food supply chains, social protection schemes due to the COVID-19 pandemic. Community programs have also been disrupted. Essential nutrition services, unfortunately, have stopped. And with the closure of schools, school feeding programs, nutrition meals have also been interrupted. The current situation aggravates the difficulties that many families, many vulnerable families, already faced before the pandemic in terms of accessing affordable and healthy diets. And these factors, if the crisis continues, are only likely to have a negative impact on the nutrition status of vulnerable groups, which we will be seeing for many years to come. What has been the Sun Movement approach at the beginning of the pandemic, during the pandemic, and of course it's continuing? First and foremost, we have continued to support Sun stakeholders at country level. And that includes through the prioritizing government support, supporting the 62 member states of the movement, ensuring that nutrition is prioritized during the pandemic response and recovery, that also good nutrition is positioned as a primary goal of food security efforts. Most importantly, the funding for nutrition is safeguarded because there have been examples in many countries of, unfortunately, funding that were for nutrition programs that unfortunately been diverted to other areas. Funding for nutrition safeguarded to ensure that the economics consequences of the pandemic on nutrition are anticipated and mitigated. And finally, the Sun Movement approach has been to continue to emphasize that a country-focused, multi-stakeholder, multi-sectoral approach where all actors come together, work collectively to align actions, remains high on the agenda, both at country level and as well as global level. We've also continued to highlight the need to bridge humanitarian and development actors and assistance, of course, under the leadership of the government, which has been key in the response, and to advocate for the importance of sustaining both nutrition-specific as well as nutrition-sensitive interventions, integrated in the healthcare response or in food systems and social protection response. Responses in the Asia-Pacific region have also been fantastic in many areas. I do not have time to give credit to every country of the Asia-Pacific region of the Sun Movement. I'm just going to mention a couple of examples. But for example, we have seen the inclusion of nutrition components in national preparedness and response plan for COVID-19 in Bangladesh. We know that in Pakistan, the early childhood development actors and the scaling up nutrition movement actors work in great coordination under the overall stewardship of the Planning Commission. We've also seen examples in Nepal, where the national level actors in the National Planning Commission and local governments have worked together to allocate special funds to nutrition. New targeted food assistance programs have been launched as a result of the COVID pandemic in countries such as Indonesia, Myanmar, and Cambodia. And I will say that overall, we have seen a stepping up of civil society, private sector, donors, as well as UN agencies in all relevant areas. What is my call to action? Should be our call to action? The Sun Movement has launched its strategy for Sun 3.0 from 2021 to 2025. There are many opportunities not only to work on tackling all forms of malnutrition, achieve the SDGs, achieve the World Health Assembly targets for nutrition, but also to work with other actors and other stakeholders. And I will say that the early childhood development actors are key to make progress. We also need to continue to strengthen and sustain strong policy and advocacy. This time more than ever is important to make sure that we keep nutrition and ECD high on the agenda. We need to continue at country level to work to develop and align shared country priorities for action and coordinate and collectively work to build and strengthen country capacity. We also need to plan ahead to ensure that once the pandemic is over, because I hope will be over very soon, high quality childcare, preschool programs with health and nutrition intervention at SIDS Center can start again. There will be funding, there will be actors to start again. Finally, we need to work together to continue to increase international as well as domestic financing to early childhood development programs as well as nutrition. And I will say that we have a great opportunity to step forward and recommit all of us, all governments, all actors at the Food System Summit, at the Nutrition for Growth Summit, which will take place in 2021, to commit to nutrition, to commit to ECD, and to make progress in these areas and other areas in the years to come. Please visit our website. I'm here also to respond to any questions you may have, and you will also see here the link to our Knowledge Hub, which we have created in response to COVID-19 pandemic, and which brings together events, documents, webinars, and any other interesting resources on COVID-19 and how some countries have responded. Thank you, Jyoti. Thank you, everyone. And I remain available for any questions you may have.
Thank you. I unmuted myself. Thank you very much, Deborah, for that excellent overview of what nutrition means for young children's development, as well as what the Sun Movement is doing to promote nutrition for young children and investments into young children's development going forward. We will take questions for Deborah, but we will do that after we have the presentation from Katharina and Juan. So over to Katharina and Juan for your presentation, and we'll take a combined set of questions. Thank you. Over to you, Katharina and Juan.
Thank you, everyone. I think it's a great honor to be here to share some of our work and related to movement behavior in early years and in the context of COVID-19. So today I will co-project with Dr. Katharina. I will be the first. So next. 24-hour movement behavior is usually a combination of sleep and sedentary behavior like sitting, standing, and different intensity of physical activities. The latter mostly in the form of play and all kinds of daily activities in early years. So evidence showed us today improving the movement behavior of young children will contribute to their physical health, reduce the risk of developmental obesity in childhood, and the associated NCDs in later life, and improve their mental health and well-being. So WHO guidelines and for the children under 12 has and also filled a gap in the WHO recommendation on physical activities. And the WHO also has identified the prevention of obesity in young children as one of its key priorities for the 21st century. It's worth for us to notice that the low and middle income countries, and especially many of which are in a period of rapid urbanization, may further impact on the healthy development of this behavior among these young children age group. The next, thank you. The next slide. Katharina? Sorry, Katharina, the next one.
Yeah, it's on there, Guan. I think it's just taking a little while to load up.
Oh, sorry. Yeah. So as a result of COVID-19 pandemic, opportunities for children to meet the moment behavior guideline has been impacted due to the measures such as school closures, physical distancing, and also home confinement, which is taken by many countries. So, and Professor Tony Oakley and from University of Wollongong and I and co-lead a complementary paper which titled Promoting Healthy Moment Behavior Among Children During the COVID-19 Pandemic, which is published in April and in the Lancet Child and Adolescent Health. And we co-work with others 13 co-authors and from 13 countries and UNICEF headquarters. And we found that the interview of 15 parents of preschool age children in Beijing, and so nearly all the preschool and age children were going to bed later and waking up later, along with increased sedentary screen time and a low level of physical activity. So similar findings also found in the some survey conducted in South Korea. So we also consider, and if this COVID-19 will especially and make the children from the low and middle income countries children especially at risk. I think it's also important to examine if children from low these countries could and show, and because the greater proportion who live in apartment and shelters, and greater reliance in this group and accumulating of daily physical activity through play and also poor neighborhood safety. So it's important for us to consider equity and minimal equipment and also the access and to the internet resources. So the last one. And so the panels and so the recommendation and from our papers and the following actions should be taken and for the parents, the health professionals and educators and also government and the social medias. We know that many parents are juggling a lack of income, food insecurity. So moment behavior may not be at the top of their priority list. However, we believe that the current pandemic provides an opportunity to raise awareness of moment behavior guidelines for children and to promote their uptake across all areas of society. So next, let's move forward to presentation by Dr. Katharina. Thank you.
Thank you very much, Guan. So as Professor Guan mentioned, the WHO guidelines that really set out those recommendations for a healthy balance of movement behaviours across the 24-hour cycle are very new, and we actually know very little at the moment about movement behaviours of young children globally, but particularly from children from low to middle income countries. And so the Sunrise study, which is an international study of movement behaviours in the early years, really aims to address this gap in knowledge. So It's the first multi-country cross-sectional study that's looking at these WHO guidelines across those movement behaviours for young children under the age of 5. And we currently have 39 countries involved in the study, which commenced in 2018. So it's a unique study because it has a sample of both urban and rural communities and has a really strong focus on low to middle income countries, particularly those that are undergoing rapid urbanisation and globalisation and have many complex factors at play. And so the study takes both objective, so device-based measurements of children's physical activity, both their energetic play and their overall movement, their sedentary time and their screen time and sleep patterns. And so both device-based measured and also parent-reported measures of these behaviours. And then there's also some direct measures of developmental indicators such as executive functions of the children, so their working memory, their inhibition is assessed, and also their gross and fine motor skills. So activities such as balancing, their ability to long jump, standing up and running quickly to a distance and coming back, those sort of motor skills are measured as well to see whether the children are developmentally on track and whether there's any associations with the movement behaviours. And then in addition, we also measure height and weight to determine the adiposity of the children. So the study also includes a really significant research capacity development component, and there's a real focus on building the research capacity in some of those locations where maybe the expertise doesn't yet exist, also providing resources and training, and with the aim to build a network of interested researchers and practitioners in the region in physical activity and movement behaviours. So the aims of the Sunrise study are really to determine the compliance with the WHO guidelines, and then to determine if that compliance and the proportion of children who meet those guidelines differs by gender, across different parental education levels, across urban and rural settings, and also whether there are differences among countries who are on various different human and economic development levels. And so the idea is to examine those associations of the 24-hour movement behaviours with health and other developmental outcomes. And to also look at some of the other factors that might be correlated with movement behaviours at the sort of social level, at the environmental level, and the physical and also the policy environment, to see what other factors are at play there that affect movement behaviours of young children. And the idea is really that the findings will inform global efforts to develop culturally specific interventions that then can improve movement behaviours among children so that they can reach their developmental potential. Okay, so the COVID pandemic really provided, I guess, an opportunity for us to follow up with some of the same children who had previously participated in the Sunrise study, and so that we could collect some longitudinal data on how movement behaviours were affected by those restrictions that were in place because of the COVID-19 pandemic. So we had collected some pilot data in multiple countries. Typically, there was about 100 children participating per country, 50 from urban and 50 from rural locations. And they served as a baseline of data. And then we invited parents to participate in a follow-up study, and they reported and answered those same questions that they had previously about their children's movement behaviours. And in addition, they also reported on the level of restrictions in their locality, the environmental conditions, what type of housing situation they had, whether they had a yard for the children to play outdoors and so forth, parental stress and exhaustion levels, and also the parents' confidence and ability in promoting healthy movement behaviours among their children. So in the 12 months immediately prior to sort of March of 2019, we had collected data in 14 countries. 8 of those were low to middle income countries, and 10 were sort of broadly from the Asia Pacific region. So we had 948 parents who gave us responses at both time points, and 71% of those were from low to middle income countries. So a really nice sample from that population that we know little about. And so here on the map, you can see where those countries are. So in terms of the study, it really presents sort of the magnitude of changes that we saw in movement behaviours, and it adds to that existing findings that are slowly being reported about movement behaviours and how they're affected during the pandemic. So interestingly enough, when we looked at the sample overall, there wasn't really a significant difference in the overall amount of physical activity for the children. Sleep duration also wasn't that different, and neither was the proportion of children who met all the 4 guidelines across movement, sedentary time and sleep. What we did see, however, was that there was a really strong increase in sedentary screen time. So 55 more minutes a day, so nearly an hour a day more spent in sedentary screen time. And the proportion of children who met the screen time guidelines dropped from 48% to 25%. So that, has some quite possibly some significant impacts on health and development for young children, particularly for their cognitive and language development. We know that excessive screen time there is really not ideal for them. Children also had delayed bedtime, so went to bed about half an hour later and woke up nearly an hour later in the mornings than they did before the COVID pandemic. And the daily nap times amongst the young children also increased by about 20 minutes a day. The time kids spent outside, both on weekdays and weekend days, decreased significantly during the COVID-19 times, as we could predict. So here we can see, though, there are some interesting findings when we look at the country level data sort of broken down at the country level. So we can see for some countries like Australia, China, Hong Kong, where we saw that decrease in total physical activity. There's a lot of data on here, so I've just included countries in the region, but we can see that before the pandemic and then during the pandemic, how that compliance with the guidelines decreased for total physical activity. But then we can also see in some countries such as Indonesia, Malaysia, Sri Lanka, Vietnam, where there was actually a really quite a strong increase in physical activity and the time spent in physical activity during the day. And so that led us to understand that there's really some very big differences between countries, and that local context is very important. So when we went back to those countries to ask what was happening, they felt that a lot of parents were now at home with the children, and so they had much more time to, a lot of parents were out of work during the pandemic, had more time to engage with their children at home, and often chose to do so in physically active ways. Another thing that was common in some countries was that children actually went to the rural areas, left the cities and went to the rural areas during the pandemic to stay with relatives where they had better access to outdoor areas. So we can see some really interesting, unique patterns when we break down the data at the country level. Some other interesting findings were that children from low to middle income countries were much more likely to meet the physical activity and sedentary screen time guidelines than children in high income countries. Obviously, children who could go outside were able to meet the recommendations more because, being physically active and having that energetic play often requires an outdoor space. We also found that caregivers who... Yeah.
Sorry, I'm sorry to interrupt, but could you start winding your presentation?
Absolutely, yes. I'm nearly on my last slide. And we found that, children whose caregivers had concern or who had high levels of stress were, those children were less able to meet the guidelines. So those issues around parents' ability and parents' mental well-being was also quite strong. So in terms of our call to actions or the implications of these findings, really the strength of the associations show us that it's really quite important for children to be able to continue with those same activities that they do during normal times. So for early childhood services and preschools to remain open if possible, to allow children to have that activity is quite important. And that policy efforts need to really be specific at each country context in order to be able to meet kids' needs where they are, that there's not sort of a one-size-fits-all approach. So that's it from me. Yeah, happy to take questions afterwards. Thank you, everyone.
Thank you, Katrina, and thank you, Kwan, for that excellent on how the built environment and the combination of the pandemic has affected the physical activity and how that has an effect upon children's development going forward. Before I make any comments on this particular part of the webinar, we'd like to open the floor for questions, and there are a number of questions that have come up. in the chat box, and I can see, Deborah, you've already answered one, but perhaps you could repeat it for everybody else here as well. And the question was on how do you come to the estimate of $1 invested in nutrition and its results in a $16 in terms of impacts. Perhaps you could elaborate upon that.
Absolutely. First of all, I have put the reference in the chat box. So for everybody, please do go and look at the Global Nutrition Report from 2014 if you would like to have some time. In general, the Global Nutrition Report is a great reference for nutrition globally. So this particular reference comes from a study that was conducted back in 2013. It was a modeling study, and it is referenced in the 2014 Global Nutrition Report. So the study showed that in line with the stunting reduction modeled by the 2013 study conducted by Butta and others, scaling up a core package of intervention, nutrition, will lead to a 20% decrease in the rate of stunting. And based on the costing to scale up that intervention, the median benefit of the cost ratio was 16 for all the 40 countries of the study, meaning that for every dollar or other local currency invested at the median, more than 16 will be returned in the 40 countries that were under the study. If you'd like to, as I don't want to take too much time, but if you would like to hear more and find out more, please visit the Global Nutrition Report website, and particularly the link that I put in the chat.
Great. Thank you, Deborah, for that. And I think what that reflects also is the long-term implications of nutrition. So it isn't just the immediate, but how good nutrition affects children's ability to learn in their environment, the caregivers, with their peers, and their learning in schools, and the impact that has upon their productivity in later life. Poor nutrition can also have health implications going forward. Yeah. So
exactly.
Please do go have a look at the, Deborah,
it shows something else? Just wanted to say, it shows the long-term investment potential, and it also shows how actually cheap it is to invest in nutrition and to have a great return. That's it. Thanks.
Right. Yes. And that brings us to the question of the physical activity and the effect that has on nutrition, and the effect the pandemic has had on children's on the restricted movement that children have, how it has affected their ability to be physically engaged with their environment, with all the online learning that most educational institutions have been promoting. So how does WHO monitor physical activity and related guidelines in different countries? Perhaps Katharina and Guan, could you answer that question? WHO's ability to monitor physical activity, the impact their guidelines are having on how the importance of physical activity is being addressed in countries, especially the low middle income countries.
Yeah, Guan, did you want to answer, or shall I go?
You can first.
Yeah, thank you. I think because partly because the guidelines are so new, that the monitoring of the guidelines is that next step, and that of course takes a lot of resources, which oftentimes in those low to middle income countries aren't always there. So the Sunrise study and the leadership team of the Sunrise study, which is a global team, has worked very closely with the WHO, both in the development of the guidelines, but now also the WHO advises the Sunrise study in terms of doing the monitoring. And so at the moment, our pilot study I mentioned is only looking at 100 kids, but the main study of Sunrise looks at 1,000 kids in every country. So that gives us quite a good representative sample of what's happening at that country level. So I guess that those monitoring systems are still being developed, and the capacity for that being built in different countries. But the Sunrise study is I guess working in that space globally. Yeah.
Yeah. Yeah, so we did one of the study which showed that conducted in urban Beijing, and we just it's actually in the period of WHO the guidelines released, and so we just compared what is actually the levels of physical activities for children in Beijing's preschoolers, and we found that, and just only 15% of preschoolers in urban Beijing who could just meet all the guidelines in WHO's and for children and under 5 years old. So we think that it is really some challenge for countries and to meet the movement behavior for early years. And we still need, conduct more survey and study and to find more evidence and to this kind of, I think, monitoring and how it's actually the moment behavior in globally. Yeah.
Great. Thank you, Guan, and thank you, Katrina. What your study is also pointing out is there are two sides to nutrition. There is the overnutrition, which is what happens when the food is bad, but also physical activity is not there, and it leads to obesity and overweight. And then you have undernutrition, which is stunting, children too short for their age and children too small for their ages. And both of them have negative impact upon children's development, both again in the immediate term, but also going forward. And it would be interesting at some point to hear from the Sun Movement as to how does the Sun Movement plan to integrate some of these findings in its engagement with the governments. And I'll use that, Deborah, as an entry point to another set of questions that are coming up for the Sun Movement, and how does the Sun Movement engage with governments and with the civil society in taking the agenda for nutrition forward, both in countries where undernutrition, poor nutrition is high, but also in countries like India, which are really big. And you mentioned in your overview presentation that there were 4 states in India out of the 20 odd states where the state governments have signed up. So Deborah, over to you.
Yes, there are many ways in which the Sun Movement engages with governments, both at country level and global level. Of course, at the global level, we have the Sun Secretariat, and we engage directly with governments through the government's focal points, who are the representatives of governments and member countries. There are many ways which we share information with them, new policy evidence, new studies, financing opportunities, etc. But the Sun Movement is primarily a Sun Movement at country level. So it's when at countries, the government comes together with civil society stakeholders, with UN agencies, with private sector, with donors. And there are many ways where the government can support new innovative research or ideas or policy and programs in their agenda, either learning or sharing experiences from countries across the regions, which is what we facilitate as Sun Movement, or through the support of donors at country level or UN agencies at country level. In terms of how it's doing its investing or it's tackling both undernutrition and overnutrition, there are a number of examples, either through, for example, support of the private sector stakeholders who are trying to work together and address issues of malnutrition through private sector, or with the government using taxation policies or other experiences. And of course, undernutrition based on the best practices and evidence and the support of UN agencies, particularly UNICEF and the World Food Programme. So there are plenty of examples. I don't have time to mention everything here, but I can say that the Scaling Up Nutrition Movement through the Secretariat supports every member state that would like to learn more or access information, policy, and evidence, and of course is open to any other countries who would like to join the movement in the efforts to scaling up nutrition. With India, just briefly to respond to your questions, yes, there are 4 Indian states that have signed up to scaling up nutrition. the movement. The government at central level is not yet, hopefully, a member of the SUN, but this does not mean that it's not engaging in nutrition. I know that from our colleagues in India, in government, in UN agencies, in donors, there is a lot of work going on tackling malnutrition, tackling all forms of malnutrition in India. And of course, we know that there is a lot to learn, and India can actually share a lot of experiences with other countries. And at any time they will be happy to join the movement, we will be very happy. At the moment, there are 4 Indian states. Perhaps there will be more in the years to come. Perhaps the central government will join. But joining the SUN movement, it is a decision of the government. So we do not actively recruit countries, but we are ready to welcome more members in the movement. Thank you.
Thank you, Deborah. There is one question for Katrina, and that is on the study itself. And the question is from Jarud Ramadan Khalidi. And Jarud wants to know that does the movement study groups children by parents' income, etc., because the increase in children meeting movement guidelines in LMIC might be because these are children in more privileged households. So Katrina, could you answer that question?
Yeah, it's a good question. And in terms of income, we actually, for our research, it's very difficult to get ethical clearance to ask families about their income levels because it's quite a personal thing, obviously. So what we use as a kind of a proxy indicator for income is parental education levels, because I guess you can make an assumption that if the education levels are higher, that potentially the income is higher as well. So we do definitely in the study more broadly look at education levels and see what the impact is there. But we're actually finding that there isn't, in low to middle income countries, there isn't a huge effect of parental income. Maybe during COVID, that's different because obviously there's so many unique factors at play there. But yes, income level is definitely, because that has then an impact on potentially the size of the house, whether there's an outdoor garden or yard where the children can play. So there's a lot of flow-on effects from parental income. But yes, we use education level as essentially a proxy measure for income.
Great. Thank you very much, Katrina and Guan and Deborah, for this excellent overview. And with this, I think what we've done is we've presented the overview of nutrition and health and physical activity and its impact upon children's development. And now we go into, from this global overview, we go into what have been the experiences in 2 countries. And we look at Indonesia and India in terms of how these 2 countries have taken the policy advocacy agenda forward on nutrition and health. So with that, I'd like to invite Dr. Sujit Ranjan from the Coalition for Food Security and Nutrition from India to make his presentation. Over to you, Sujit.
Yeah, thank you very much, Jyoti, and very happy to be part of today's this discussion. And as all of you are aware, India is not battling COVID-19 outbreaks only, but is also fighting existing undernutrition in the country, and the spread of COVID-19 has impacted the health, nutrition, livelihood, and well-being of India's most vulnerable population, and will have lasting effect on people. So my presentation is based on that, and I'm representing the Coalition for Food and Nutrition Security. This is a unique platform in the country, India, and this platform was launched in the year 2007, and it was formed like how to bring all the stakeholders, especially the people, those who are working in the field of food and nutrition security, like government, public health nutrition professionals, organizations, how they can come together and take this nutrition and food and nutrition security agenda for all in the country. And the raising awareness, collaboration, and the advocating is the primary mission for which this coalition is working. And as an executive director, presently I am managing this coalition with the help of more than 500 members, respectable members, those who are supporting this coalition. So far as this why nutrition matters in pandemic times in India, that's very clearly this. I'm having two pictures of our country, and you can see like in one side the stunting among the children, and the other side the obesity, overweight and obesity. So the pockets, you can see that in red color, that's the very high prevalence, as well as yellow, that's the high prevalence in stunting, as well as in the West End. So malnutrition in India could have implication and the COVID-19 health impact. And it's important to understand the background of this. So in last 10 years, it has been, we together, we learn, we recognize what is the problem, what are the problems, what is the underlying causes, the root causes. And also like this nutrition community in India, like we try to align to go for a multi-sectoral approach, to go to bring all the 9 departments, like our ministries together, as well as different players together. And accordingly, lots of policy changes took place in the country, like nutrition started in a mission mode. And like the National Nutrition Mission was launched in the year 2018 by our Honorable Prime Minister. Then at the same time, the investment, how we can take care of the investment in the field of nutrition and monitor it more carefully, like the data management. So, but this COVID-19, it's a kind of big, have given a big jolt to the nutrition scenario in the country. And there are like the direct impacts, otherwise, and at the same time, the indirect impact. So the direct impact, the infections, COVID-19, you can see the implications, which I have tried to gather with the help of all our members and our study from various states, like that directly impacted the health status of the children, pregnant and lactating mothers, and the diet quality also. That availability, accessibility, and the food at household level, and the utilization. And the indirect impacts, you can see like the lockdown was there for a long time, and the social distancing that is already there. So service providers are not in a position to reach to all the beneficiaries. The counseling was an issue, the screening was an issue, the immunization was on hold. So that kind of challenges we faced, and changes to health and nutrition programs, because the priorities change. Government priorities was mostly on like the healthcare facilities, so the priorities also changed. And the education linked program like midday meal and the supplementary nutrition from our midday meal from the education, as well as the supplementary nutrition program of the integrated child development schemes of the country. So the outcomes was the malnutrition among the population that directly affected. And some of the data we tried to collect directly from the field, like I'm just quoting the example of 2 states of the country, one of the largest states, and Deborah was talking about Jharkhand, and screening, like screening was screening and the growth monitoring of SAM children was suspended for a long time because of the infection. Center was closed, and the service providers was, though the government of India had taken a decision to provide the supplementary nutrition at the doorstep, but the other services were suspended. And the take-home ration, the ready-to-eat food, that was also, though that was, they were providing to at doorstep, but the topography at the same time, some of the people were not willing to take the THR or the take-home ration because of the infection issue. Then the counseling part was a major issue. It was very difficult to reach to the pregnant lactating mothers, and especially the children, those who are having some danger signs. So identifying the danger sign, the counseling, that was an issue during that time, and the monitoring, lack of monitoring and supervision of that. So if when this coalition and all the nutrition community, including the government, how to build the consensus among all of them, we came together once again, and the coalition provided that platform in the country, almost in last 10 years, in India, 2014, this coalition submitted a document to Government of India that was the call to action. So India, because we are having the high level of malnourished children in the country, so we prepared together all the UN organizations, civil society organizations, government research organizations. We came together in the year 2014, and we prepared a document called Call to Action. Call to action, and based on that call to action, Government of India decided to take this nutrition in a mission mode in the year 2018, and the high level of commitment was there from the leadership and the evidence-based framework, then the data effect, then at the same time the finance part. Now we felt that again we have to come together, the broad range of stakeholders, and all of them again came together. And under the platform of the Coalition for Food and Nutrition Security, and all broad range of our stakeholders, and the country, how to learn from all the states, because India is a large state and the population. So try to learn all those issues with the help of all our organizations, and we decided to go for the commitment to action. So earlier that was the call to action, and now this is the time when all of us can go for an advocacy for the commitment to action at every level. And the commitment to action, I'm unpacking this because this is the urgent time, and we identified 6 areas where the commitment for action is very much needed, like the sustained leadership at country level, then the state level, as well as at district level. Then uninterrupted universal high quality coverage, like the services which were on hold or suspended, how immediately that can be started with the new normal, and how we can train the functionaries in a more professional manner so that they can provide the services, and ensure the financing part. So the financing part was because of the COVID that was also affected, and accelerate the nutrition sensitive issues also, not only the sensitive issues, how we can take it forward, and the data culture, how to build the data culture, because during this COVID we felt that data was not available. That's why the counseling part was affected. Data was not available, like household level wise data for when we can use the mobile health. The data was an issue. So here we identified and we tried to develop this data culture in a more promising manner, and leverage all the stakeholders for a holistic view and the multi-sectoral approach, because food security was a big issue we identified, and how the Nutri Garden and how the kitchen garden and the agriculture, horticulture can play an important role here. So this was the...
Sujit, I'm sorry to interrupt you, just reminding you of the time.
Okay, I'm just last 2 slides. So based on that, you can see the slides. So we identified 2020 and beyond. Right hand side, you can see, like I already mentioned, and it has reminded like malnutrition itself could affect in India as a course of the illness. The pandemic can also be directly affected with the malnourished, and the multiple system that affect the coalition, so that affect the nutrition. And at the same time, the Government of India has came forward how to link the income generation activities and the employment guarantee scheme with the Nutri Garden. So that was the wonderful steps by Government of India, and because the children cannot wait for that. And I'm very much sure this is the time when the civil society organization is also playing an important role for boosting the data culture, the public-private partnership. At the same time, engage the communities in a more effective manner and promote Nutri-Garden and the information technology. So these are the steps taken by the government and the civil society organizations under the banner of this coalition was providing that platform. And thank you very much for giving me an opportunity to present the case and it's already going on. Thank you very much.
Thank you, Sujit, for that excellent overview of what it means to take an issue as big as nutrition and share with you the experiences in translating it into action and also identifying the challenges, going in terms of continuing to keep nutrition on the agenda for the government and for the other actors. With that, I will now invite Dr. Bryan to make her presentation, and then we will come back to questions for the two of you afterwards. Just a reminder to all the participants, the audience of this webinar, please continue to put your comments and your questions in the question and answer box. And we also invite you to put in your recommendations for which of the specific topics would you like to hear more on within this theme of health and nutrition and young children's development. So please continue to remain engaged by using the chat box and by using the Q&A session. Thank you. Over to you, Dr. Bryan.
Yes, thank you, Jyoti. Yeah, again, thank you very much for the time inviting me for this webinar. Sorry. Yeah, so I represent Indonesia to share to all the audience in here our COVID-19 response, particularly related with the nutrition solution and innovation for young children. So currently, I'm the senior advisor working for the Executive Office of the President, the Republic of Indonesia. And then for this presentation, I will, as suggested by the OC, it will be 4 sections related with the problem, and then action, result, and the last is the summary or call to action. So back to Indonesia, our first case of COVID reported on the 2nd March of 2020 until yesterday on 10 January 21. There are more than 800,000 confirmed cases and more than 24,000 deaths also reported. Until today, new cases are still reported and additional death also still reported. Of course, the data every day is up and down, but Indonesia still, positively we can respond to this pandemic. And this week, actually, we will start the national program for vaccination, COVID-19 vaccination. Yeah, so how the COVID-19 impact affect the health and nutrition status in Indonesia. Actually, we have a difficulties on the collecting the data for 2020. So what I can share in here is that actually for the health status by October 2020, if we see in here that complete immunization for infants only 54%, and even for the baby, I mean for the children above 1 year for measles immunization is only 41%, when the target for year's annual target is more than 90% for immunization and 76% for measles. And then the same also for the fourth antenatal care. Our coverage by October is only 48%, and child delivery at a health facility is also only 47%. So assuming that until December, maybe the figure will be increased, but we not sure that even this achievement will meet the target. And then the same also with the nutrition. Even we have, until now, we have no data available yet for the nutrition status for children. But until last week, I got the information from the Minister of Health that our research body is still trying to calculating the nutrition status. But if we refer to UNICEF says that wasting increased globally 15%, so we assume that refer to our data for wasting in 2019 around 7 to 44%. So maybe in 2020 the wasting percentage is around 8.5%. Of course, this data is still not really as a public health problem, but we know also that the wasting actually will increase the children under 5 deaths around 12 higher, and then also stunting increase the risk for stunting 3 times, and also as an underlying for child illnesses around 54%. And then again, we still struggling with the data, but there are some online survey conducted by some organization, and also by the government also. For example, in here, I quote the survey conducted on May 2020 by Wahana Visi Indonesia, the national partner of World Vision. From the 900 households, it's around 900 also children participated. Basically, the survey saying that COVID-19 pandemic really has given impact to the household level. So it's related with the income, household income, and also access to the health, nutrition, and also access to the water hygiene and water and sanitation. Yeah. So the major challenge that currently until now is what happened in Indonesia. I see this in the two major things. The disruption of primary health care, because we also have the information that actually the attendees of Puskesmas, the primary health center in Indonesia, the attendees is decreased 83%, decreased 83%. And then disruption also the community-based health services, what we call as a posyandu, the community health post, which is only less than 20% still operated. So these two things give an implication to the services of health and nutrition. For example, the limited distribution of MCH medical supplies because of the lockdown from other country, and also the difficulties to transfer the medical supplies from other area to another area. And then mother class, that is for the education, is not allowed because of this pandemic. And then the coverage of antenatal care, the normal delivery, and the emergency obstetric neonatal care also impact, because there is an unclear procedure of screening for COVID-19 and also the referral case for example, the pregnant woman or delivery with COVID or not with COVID, and the lack of a hard workforce. I mean, many of the health workforce is mobilized to the COVID referral hospital, and then some also dead or sick or quarantine. So, and then limit private practice also. And the impact of the disruption of community-based health services also, for example, the growth monitoring activity is limited. And then actually in Indonesia, not all services conducted at the health facility. Many are conducted in the community health services, the posyandu. So again, the growth monitoring is impacted, and then the immunization and vitamin A supplementation for infant also temporarily postponed. Actually, this is for the first 2 months of the pandemic. And then the health education, including the motoric stimulation for early age, cannot be conducted. Iron tablet supplementation and direct breastfeeding counseling also cannot be applied. Again, this is in the first 2 or 3 months after during the pandemic. And then what happened is that during the pandemic, families were expected to take the main role in monitoring of child growth and development before they can visit the posyandu or visit the ECD center. But during the pandemic, everything is rely on the family. Yeah, this is still in Bahasa, but I just want to show you that the activity in the primary health center is still happen, but it's decreased the number of attendee, and then also the impact to the health coverage in many figure. This is for the immunization, this is for the posyandu activity, for the antenatal care, and etc. etc. Yeah, and actually we also know that the COVID-19 affect everyone everywhere. So when there is a question about the most vulnerable groups, because it's not easy to answer this question, because again the COVID-19 affect everyone everywhere. But the urban community is more risky due to viral exposure and population density, not because the urban itself, but because the exposure in the urban area is very high, and because the population density. And then also less wealth family is more at risk than the family that has a better wealth status. So in here, meaning that the poor family, what we call is the first quintile, and then the household who lost the job or reduced income because of less economic activity, particularly who are working in manufacture or in informal sector. And also the family of not resident citizen in the high exposures area. Because many of the support is actually is given priority given to the resident of citizen, but many in the urban area, people come also from another city. And then children with special cases like disability or suffering chronic illnesses, etc.
Dr.
The
Bryan,
action, yeah.
Sorry, I'm sorry to interrupt you, but your
Yeah.
time's up. So I'm hoping that this is the final slide, is it?
Oh, okay, yeah. So the
Thank
adaptation
you.
that we did is we try to adapt the normal delivery managed by the midwife clinic collectively, and then ECD post and posyandu are operated only in the green zone, and then adjust the health protocol and telehealth and the allocation and refocusing government budget of 2020 for a pandemic response. This is the example, the picture that we did. And then also there are policy program adjustment, basically that we revise many of the document in here, the technical guideline, adapt to the new normal, and then also for the posyandu, because we want that this prolonged pandemic, all services still can be conducted. So how we reaching the most vulnerable group is by collaboration with social affairs ministry, particularly for the food basket program and what the cash conditional cash transfer program, and also very selective home visit with proper personal protection equipment. The lesson learned, telehealth is solution for us, but challenging if the IT infrastructure is poor and family literacy on technology is not adequate. Hoax and misinformation are spreading faster than information disseminated by official due bureaucracy of approval and review process. And then the call for action in here is Indonesia is transition from rural community to urban community. So the call in here is how to accelerate the infrastructure development, the technology, information, and digitalization in a rural area. And then Indonesia today's agenda is human development, started from 1,000 first days of life, and family resilience and parenting skill capacity are important. It will be the focus for this post-pandemic recovery. And also because the population density, diversity, and disparity of Indonesia, solidarity and collaboration need to be more promoted. That's all from Indonesia. Thank you.
Thank you very much, Dr. Bryan, for that excellent presentation on the services and the impact that the pandemic had and the responses that were taken in Indonesia. There have been a number of comments and questions for both Sujit and for you, Dr. Bryan. So I'm actually going to start with a couple of questions that I'm combining into one. The questions were raised by and the points were raised by Devina, by Salman, and by Khyati. And the point that was being made was that poverty is a major impediment to good nutrition. That's one. Secondly, there is also the impact that the availability and the cheap availability of junk food, which is becoming almost ubiquitous in rural areas as well as urban areas. How do we counteract these? How do we address the issue of poverty in addressing nutrition issues, and how do we address the issues of availability of easy availability of junk food? And then related to that is a question of from Kathy about when we talk about policies and programs, especially in a country as diverse as India, where there are every state has its own kind of approach, but then when we look at the policies, there are blanket policies. How do we ensure that there is a customized approach to the issues related to nutrition in the different states? So that's for you, Sujit, if you can help us understand these three dimensions for nutrition.
Yeah. So thank you very much for this question. And as I mentioned that the nutrition and food security is a challenge and a big issue here, and we have identified during this COVID time we have identified this issue at different level and different stages, and still we are trying to learn. I tell you, like so far as the food security is concerned, India is a food surplus country, and the problem is the distribution, the proper distribution and accessibility is always an issue. The awareness is also a big issue. So here, Government of India has already taken a decision, like the fair price shop, our public distribution system, how the one card will be applicable for the entire country. At the same time, even the migration is an issue, so people can get the food from the fair price shops and the public distribution system wherever they are. And the second, I'm very happy the way, based on our lots of advocacy with various ministries, like the Nutri Garden now has come up in a big way. And recently, Ministry of Women and Child Development in Government of India, they have signed a MOU with Ministry of Ayush so that the nutrition centers, the Anganwadi centers, which we are having at community level, how the Ministry of Ayush, Ministry of Horticulture, Ministry of the Health can provide the support so that the Nutri Garden can be promoted there at nutrition center. And and also I'm happy that to highlight the individual, like Ministry of Rural Development. They are primarily responsible for the the scheme which we are having here in our country for employment guarantee scheme. So government has already taken steps like to link the Nutri Garden with the employment guarantee scheme. So the people, those who are the beneficiaries of our nutrition program, they will have access to the employment guarantee scheme, and they can use the employment in developing the Nutri Garden. So already in some of the states, like in India, there is a state called Odisha. Government of Odisha has already allocated a huge 500 crore in Indian currency for this Nutri Garden. That's the positive, and we are taking this agenda forward. And coalition is also taking this Nutri Garden as a kind of advocacy agenda. So this is one thing. And the second, you mentioned about the overweight and obesity. So this is, I mentioned about the double burden which we are having in our country, and in the recent data of National Family Health Survey, this has given a different picture to all the researchers and the program implementers that how to take it forward. And Ministry of Health Government of India and our the body for like FSSAI, they have already taken a decision to reduce the trans fats from the Indian processed food, and from like by 2022, it will be a kind of 2% in trans fat. So that's the positive steps, and that's the good advocacy success we are having. And I hope that this will give a kind of new, but this is only the scheme. It's the most important is how to take it forward, how to go and change the behavior. That's the behavior change is very, very important. And here the role of civil society organization, role of our frontline workers, the role of other sectors are very important. So that we are also trying to collaborate with all of them, so that we can ensure that at a school level and household level, how we can reach to that. Because this has come in a very we have to go in a very strategic manner, because this junk food is not only in the urban areas of India, rather wherever you go in the rural areas, you'll find all kinds of junk food available, and that is cheaper than the nutritious food like the vegetable and the fruits and the other things are available. So that's the big challenge we are having, and I'm hopeful that with the help of our system and the civil society organization, we will take it forward in a very planned manner.
Thank you very much, Sujit. I'm going to switch now to Indonesia and ask Dr. Brian the impact that the pandemic had on the services and its impact upon specific groups that you mentioned in your presentation. There are two parts to this question. One is, how did you lead this collaborative effort? What are the lessons that are coming out of that for the future? And that's one part of the question. And then the second is, in terms of, you mentioned that there were certain groups that were impacted more negatively, residents who did not belong to that area, children with disabilities. In the planning for future such adverse events, what are your thoughts on that? How do you think that that should be taken forward by the government in Indonesia? Over to you, Dr. Brian.
Yes, thank you, Jyoti. Yeah, as part of the response from the government during this pandemic is we have what we call as a pandemic task force. Sorry. Yeah, the COVID-19 response task force, and then led by the disaster body, national disaster body, and then consists of many multi-sector. And then later on, after months, because then we also have we see that the economic impact by the pandemic also increase, and then this task force is reduced to the low level, but then another body that more involving more ministries also involved. And then, so basically, I want to say that the government really lead the action for this collaboration, but then particularly in the last few months, yeah, and at the beginning, we also involve many volunteers, including from the university. So we divided into four, if I'm not mistaken, into four division. One of the division is about the volunteer, to organize the volunteer. This volunteer lead by one of university, the biggest national university Indonesia, and then who can mobilize 1,000 volunteer. And this volunteer also working in many facilities and also do so many things. And then Indonesia learned a lot from this pandemic, and we see that actually we learned that many of the system Indonesia is not really ready to the big pandemic like this. So our next program, it's part of the national program, and it will be part of the 2021 national action plan is to do the reform for social reform and health system reform. And this is the plan that we do. So again, if we talk about the health status, for example, we will see to the all component of health system. There, for example, we have to improve the health workforce system, and then the health financing system, the information, particularly for the information. We learn a lot that, however, we have to, this pandemic has led us that the 4.0 is important. So the telehealth is important. So we move actually a lot our services into maximize the use the telehealth. Telehealth meaning the telemedicine and also the telecounseling related with nutrition. Telecounseling is important, but of course I cannot say that this is more. It's better than conventional counseling. There are so many challenges, but we have no option, in this situation, because even until today, we still have what we call as a social distancing, community level social distancing. There's restriction to do the many of the community activity, the public activity. Yeah, so we still working a lot how to maximize using the technology of information. So yeah, again, the plan is to reform the social reform and health system, and it's already in our government plan for 2021.
Thank you, Dr. Bryan, for that, for those insights. What I was going to take a question from the question box, but I think Sujit has already answered that. Sujit, perhaps you could share that with us, the question of decentralized data and letting data be made available and utilized by the state governments. Could you please share your thoughts on that and how we can advocate for more data availability at the lowest level possible? Thank you. Sujit, over to you.
Yeah, so this is, I think, as I mentioned in my presentation, the data culture was a big challenge during the COVID time, and in India, there is a Niti Ayog, the national and Niti Ayog in the country, like all the policymakers have realized this, that data culture should be improved. And recently, like they are coordinating with all the state government, especially the National Nutrition Mission and the National Health Mission, how the data at district level can be analyzed, and also data visualization can take place in a proper manner, so that the immediate feedback and the decision making process can be more robust based on the available field data. So in all the state that is already going on, some of the states have already proved it. There are few states like Tamil Nadu, Gujarat, they have already proved that they have come up to that level. But there are few states like Jharkhand, and then your Madhya Pradesh and Bihar, they all are trying to develop that culture in their state, so that the data processing and the data visualization can be taken on a priority basis. And the coalition is also when I was sharing the call to this commitment to action. So commitment to action is one of the important agenda, is the data culture has to be strengthened at local level, so that the issues can be handled and taken care of at local level, and that is already has been identified, and lots of capacity building, then even the infrastructure changes are taking place, and Government of India is very serious about this, and hopefully in coming days this will give a very new direction to all the functionaries like us. Thank you.
Thank you, Sujit, for that additional information. And data is actually a very good point to bring this webinar to a close, because it links not only does it inform what we already know, but it also needs to tell us where we need to go forward, and the more granularity that is there in the data is going to help us prepare and plan and intervene at the level where the interventions are most required. So, and it also goes back to the starting point of the webinar, and the presentation from the Sun Movement and from Katrina and from Juan, that monitoring and providing information is the way that we keep track on where we're going and the impact that it is going to have on the future generation of children. So very pertinent discussion on the various issues that have come up through this webinar on nutrition and its impact on young children, and the long-term implications that it has not only on individual children and their families, but also on nations themselves and the productivity of adults. I would request all of you who've participated in the webinar to keep this conversation going through ARNEC and the platforms and the webinars that it offers, because this is just the start of a discussion on this particular topic, but ARNEC also conducts similar webinars, and it has plans to take this whole concept of nurturing care framework forward in the coming webinars. So please keep that discussion going and keep participating. It has been an immensely productive session, and the one that we look forward to continuing with your active engagement. Thank you to all the panelists for taking the time and presenting. And to the participants who remained engaged. I'm going to hand over now to Andrea and to Evelyn for the next parts of this webinar. Thank you.
Thank you, Jyoti, for excellently moderating this webinar. And thank you once again to all our presenters for sharing their knowledge, insights, and experiences in this very important topic. Just a couple of reminders and requests before we finally close. I know we're running out of time, but this is going to be very quick. All right, so you will receive the webinar documentation summary by email not later than Wednesday. So please watch your emails, as we will be sending you the summary discussions from this webinar next. You will also be able to download all the presentations from today's webinar and also from previous webinars if you visit our website, www.arnec.net. And the next webinar on this series would be on responsive caregiving and playful parenting. So please stay tuned in terms of the details and announcements for the next webinar. And last but most importantly, we request you to complete the evaluation before you leave. Use the link in the chat box or this QR code. It will only take you less than a minute, and it will really help us in shaping the next webinar. So please take a bit of your time to accomplish the evaluation of this webinar. Thank you and stay safe, everyone.